I absolutely believe in preventative medicine, right? Again, health is not something you have or you don't have. It's something that everyone needs to work at.
For males, we typically recommend from 18 to 50 an annual physical exam with their physician, primary care physician, where we discuss many of the social aspects of life at that time, which include things like smoking, alcohol, drug use, exercise, diet. Not really any screening tests that have to be done aside from the routine blood work that's done once a year, looking for things like diabetes, cholesterol, so forth. At 50, we do begin to talk about colon cancer screening and ordering a colonoscopy for patients at that time. And then for the prostate cancer screening, we have a conversation about the PSA test, which is a conversation with the individual patient and the doctor, and a rectal exam at that time.
Everyone, regardless of how old they are, should have their hemoglobin checked, white cell count checked, blood sugars checked, kidney function checked, liver function checked, thyroid, and cholesterol. Sometimes I check for vitamin D.
For women, the discussion about mammograms, whether to start at age 40 or age 50, is something we usually have a discussion about, whether to do it every year or every 2 years, depending on which guidelines you want to follow. And then for men at age 55, we have a discussion about prostate cancer screening. Is it right for you or is it not right for you?
Each person is an individual and they come with individual genetics, individual family history. So we always say to patients, make sure you discuss with your doctor, your provider, to figure out what's most important for you. We have some general guidelines that we use from different associations that have studied to see what are the best, recommended screening tools that we should use for patients, but always prefacing it with, make sure you're screening based on what you need.
Talking about chronic medical issues in terms of preventing disease states and suffering in the future is where the rewarding part of my job comes in, but also is one of the most important parts.